Tonight in Getting Healthy, we're talking about care. You know, that word preceded by, I don't, when your teen's storming out of the room. Well, this is about a different type of care. And great news often explores the intersection of technology and healthcare. For instance, your doctor has probably gone electronic, yes? Instead of looking at a chart and going, I see, go on, he's now over here on the computer going, I see, go on. And all that important stuff that's actually happening between your doc and the computer used to be just for you. But now Trillium Health has used aggregate data from multiple sources to create the Acuity Scale.
So if our patient here is Spider-Man, right here, hello, and he's at 50, which our scale would account for, lots of different features, lots of different things, we'd want to make sure that we would find a controlling item, whether it's number of hospital visits, maybe it's a viral load, something that we can help control and try to get that patient down to a much lower score. And we're going to use the Acuity Scale to measure the things that get us the best results. Maybe it's a number of interactions with staff. Maybe it's a particular staff member, so that we're not just throwing resources at it for the sake of throwing resources at it.
So Trillium has patients going down slides and losing points, and somehow everyone's better for it. And while that sounds awful, it's really so good.
Ultimately, what really drives me is the need to help people. I want to help people. My whole job needs to be surrounding helping people.
MetisCAD is a tech company, and they've created the first business intelligence platform for human service provider agencies. At the most basic, they get e-health records into a care system disassociated from a world of problems and patients, and they made their product about care.
Hey Brenda, what you working on?
Well, I'm working on testing our Connect Exchange. So it's really cool. You want to see some stuff?
Yeah.
Well, what we have here is a map, and it's a map of all the members that are in one of our agencies. So check this out. You can get down in further detail, and you can go look at Rochester. 210 people in Rochester for the agency. You can even see the locations of where they are and get down and right in depth. It helps those agencies out so much. You want to see more?
Yeah, that's awesome. What else can I
Okay, well, we have some reports that are so helpful as well, of course. Here we have the BMI by living situation. I'm actually zoomed in right here, so you can check out if the obese is 30% or higher, if they're overweight with a BMI of 25 to 29.9. All this helps on what services that's going to give the members that we have the best options to live healthier, and what we can do just to help them out and get to be healthier people.
Tonight's last Getting Healthy feature starts with an IT department emergency that was live streamed on the internet recently and retweeted by @DougEmbledge. Here, take a look.
Oh man, God, I don't feel very good today. I don't know what I ate last night. I had some sushi, so I'm gonna go to the imaging lab and see if the touch ultrasound system can see what's going on with me. I hope this can identify what's wrong. So let me start scanning here. Oh, there's the problem right there. It's my sushi. Look at the pictures though, this is incredible. It's alive though, I don't think it's supposed to be alive, is it? No wonder I don't feel very good.
There was a fish in his stomach. Mark, brother, please, I hope you're listening. This is @JoshPies. Find me on Twitter. You need to seek help. There's a whole fish in your stomach. And you know, I think I've seen this tech in a movie before.
Oh no, not again.
Ultrasounds are nothing new. Most of us have seen the living jumping bean in utero and thought, I'm gonna have to put that through college? But CareStream is a world leader in making sonography increasingly better, and their new touch ultrasound system does just that. The touch-based UI is where it's at.
The new dynamics of healthcare. The stakes for sonographers have never been higher. One false move and department productivity and patient satisfaction can plummet. The time has come to give these special agents an ultrasound system they can personalize to propel their efficiency. Replace the one-size-fits-all control panel, littered with buttons and knobs for a sleek, smooth surface with a revolutionary combination of touch and sound.
Great Rochester technology companies care to get it right when they empower caring people to care for humankind. And that's something we should all care about. Back to you, Doug.